Today, we're going to talk about actions we can all take to protect ourselves and our loved ones from COVID 19. Julie Willems Van Dyke is the Deputy Secretary at the Wisconsin Department of Health Services, and she joins us now. Good morning to you, Julie.
Good morning. How are you today?
I'm doing well, thank you. I
Good.
think that a lot of us are encouraged right now because we're hearing more and more about a vaccine, and a lot of people are very hopeful about this. But I also wonder if it tends to kind of make us think we can let our guard down right now.
Yeah, I think that's a great question. And we are hopeful about vaccine. The early reports of the vaccine show that it is likely to be very effective. But let's not get ahead of ourselves here. It will be coming in fairly small numbers early on and then building over time. And so we will get vaccine to people, but it will take time and we need to do it in a safe manner. Um, and in the meantime, that means we need to continue everything we're doing right now to help control the spread of COVID 19. And this is probably going to take at least about 6 months for us to vaccinate while we're still wearing masks to protect each other, while we are still maintaining social distance of at least 6 feet from each other, while we're still continuing to wash our hands very well, and while we're still limiting our social circles. So, I know everybody's sick of that. I know we are, but we can't let our guard down until we get well into the vaccine process. And again, to vaccinate millions of people can't happen overnight. It's going to take months, not days.
It's such an important reminder. You're wearing a mask. You mentioned wearing masks, that we need to keep doing that. It's true, isn't it, that wearing a mask is definitely helping to prevent the spread. I mean, if people are wondering, should I wear a mask? Shouldn't I? Do I really need this? I mean, it is true that the research shows that it truly makes a difference.
It absolutely does. And the thing about a pandemic is we are learning as we go. And so we didn't know as much about masks back in March and April that we know now. But now there has been studies that have shown where people are faithfully wearing masks and everybody is doing it. You see significantly reduced transmission in communities. There have been comparison studies of communities who invoked mask mandates and wore them to those who did not. And it is very clear that it is helping. And recently, CDC came out and let us know. We've said my mask protects you because it keeps you from being exposed to my respiratory secretions. But there's increasing evidence that my mask also protects me from your secretions. So wearing a mask and then keeping that 6 feet of distance is a really good preventive mechanism for us all to keep doing. And we'll need to keep doing that into a good part of 2021.
Talk about the importance of testing, if you would, because there's certain things that testing does for us and some things it doesn't do, correct?
Absolutely. So you may have heard the governor or the secretary say a test is not a ticket to go to a party or go to a holiday event. And so, what a test does do is detect whether there is presence of the virus. If you're getting a PCR test, which is the most common test we've been using, it actually looks for presence of the virus in your nose if you get our nasal swab, or in your saliva if you're doing one of our spit tests. Um, and it tells you on that particular day whether you are infected with COVID 19. Now, the reason we have this long 14-day quarantine period is because when you are exposed to COVID, it can take up to 14 days for that virus to develop in your body. So, a test will only tell you if virus is present today. It does not predict if you've been exposed that 9 days from now, virus will be present. So we really encourage people to test under a couple of circumstances. One is if you have any symptoms. And one of the things we're finding is lots of people are starting their COVID infection starts with as simple as symptoms as like a runny nose or, a typical common cold symptoms. And so that's tricky, right? We only, are you going to go get a test every time you have a cold symptom? But, if you do, you should stay home, see if it resolves in a day or two. And if it doesn't, go get a test. But colds, runny nose, cough, shortness of breath, fever, loss of taste or smell, these are all the most common symptoms of COVID-19. And if you have them, call your healthcare provider to get a test or check out one of our many community testing sites around the state. You can find those at dhs.wisconsin.gov/testing.
Because the holidays are still here, a lot of people want to get together. They're tired of this, as you mentioned. Is it safe for families, some extended families, to get together?
Yeah, I'm sorry, it is not safe for us to get together with our extended family, and particularly extended family traveling from other parts of the state or the nation. I encourage people to use creative ways of getting together, to get on Zoom like this, to do gift openings or holiday toasts or holiday meals virtually with each other. It is safest right now to stay with the people that you live with and celebrate in person with those folks and celebrate virtually with others.
I want to make sure I address the emotional health portion of this, because I think this has gone on so much longer than people expected. And I think it's really taking a toll on people.
Absolutely. It is much longer than any of us thought. The good news is I want people to keep focused on we're going to get on the other side of this here in 2021. But in the meantime, we encourage people, if you are feeling depressed, if you are feeling isolated, please reach out to friends, reach out to family. Our website, resilient.wisconsin.gov, has a number of resources for you. Take care of yourself, find ways to exercise, try to eat healthy foods. That all helps our mood, but definitely staying connected to others and reaching out for help with a mental health professional if you are having struggles with coping. It is very normal right now, and help is very important.
Thank you so much for your time, Julie. So, some great and very important reminders. We appreciate your time.
Thank you.
Absolutely. And remember, wear a mask, stay home, wash your hands, stay 6 feet apart, and together, as they say, we can all stop the spread.